Hey, it's Corrine, the terminated nurse from Nelson. I'm in Victoria right now, standing in the BC Legislature. I was here yesterday for an event that I'd like to give you a little bit of updates on. But before we start, I thought you might be curious to see what the inside of this building looks like. Hi. So there has been an effort over the last couple of months to get signatures on a petition that is opposing the new Healthcare Professions Act, which was passed last November. There has been over 17,500 signatures collected on this petition, and John Rustad, one of the MLAs from Northern BC, submitted this to the House yesterday. In this process, he did ask if there were people from the public who wanted to be present during the submission of these petitions, because this issue has been such a huge problem with healthcare professionals. So to give a little bit of background, last November, Adrian Dix and David Eby both pushed through a whole new law that is going to totally change how the healthcare and professions are going to be handled in this province. So basically what has happened now is the politicians have taken control of the healthcare system. They are going to determine what your care provider can give you for healthcare information, what kinds of treatments that you're going to be able to get. Also, there's going to be a whole new increase of disciplinary measures that are going to be enforced onto healthcare professionals who do not take the standard government party line. So the process yesterday was John Rustad asked for at least 50 healthcare workers to show up while he presented these petitions. So we were all gathered outside, and then the legislature decided that we were too much of a potential risk, and so only 25 of us were allowed in the House. Now, interestingly, this is the first time that I have been in the House, so you have to come through some pretty secure security measures. There's a lot of security guards around. You have to, our phones for entry into the galley were confiscated, so we couldn't take any pictures. Now, I thought that it was super interesting witnessing what goes on in these sessions with all of the MLAs. So they were in session from 10 to 12, and the first part of this meeting, there was prayers that the will of the constituents would be brought forward. We're still waiting for that to happen. And there was also a lot of preambling at the beginning, where MLAs spent a lot of time welcoming their family members to the session, thank yous to parents for showing up, hellos to nephews that were in public school groups that were showing up. There was a lot of attention to congratulations to the grads, and congratulations, it was Star Wars Day, and it really felt like the valuable time that should be used in session for dealing with the issues that are very present, where it just was a lot of high school type communication at the beginning. It felt very, it felt like a waste of time. When they finally did get into the real issues, so for instance, the opposition brought up that there's an MLA named Yabby somebody. He took over a riding in Vancouver and then promptly moved himself to Victoria. They brought up that over $70,000 was billed to the public for his transportation on Harbour Air between Vancouver and Victoria. And they wanted to know why the public was financing this. So the response from him was, well, we'll look into it. As well, apparently there is a financial forensic audit that was supposed to be released from the David Eby to the housing. It was regarding money around the housing ministry, and the opposition has said that they need those numbers in order to be able to budget for next year, and there's only 4 days left in session, and the only information that they've been getting from Eby has been redacted. So there's issues where Premier Eby is actively blocking information that is providing obstacles that the other ministers are not able to conduct business on behalf of the public. So again, that was Premier Eby wasn't able to tell them when he was going to give them that information. So it was very interesting to observe what actually goes on, who in this area where these guys are supposed to be our leaders, and they are governing what is happening to us. And it was very apparent between Eby and Dix that the NDP are very much not cooperating or providing the resources that's needed for the whole government to be able to operate. Now, in regards to this Healthcare Professions Act, John Rustad, who is an MLA from the North, he is really trying to represent rural communities and healthcare workers. So he's getting a lot of communication from the rural areas that their healthcare services are disappearing. They're having to shut down emergency rooms. They're not getting adequate provision of care to the public. They're communicating to him and other MLAs. And so as a result, he started getting more informed, and part of this was as well that we still have terminated healthcare workers that are not allowed to work in this province. So now he brought up that the public is concerned about this Healthcare Professions Act because as practitioners look into it, they're realizing that there's so many restrictions that's going to be put on their license, and the fact that there's so many penalties that many of them are looking at having to leave the province because the conditions of what the government is formulating for the provision of healthcare is becoming very punitive and controlled. So John Rustad did bring up to Adrian Dix to reconsider this Healthcare Professions Act. Now, Dix's reply was he had consulted with 4,300 healthcare professional people in the construction of this bill. Except I can tell you for sure that the College of Nurses, the BC College of Nurses, who has over 63,000 nurses in this province, were not informed. We talked to them. They had absolutely no knowledge of this Bill 36 and the new Healthcare Professions Act, and were not able to tell us how the implementation was going to change the practice of nurses in this province. So here we have one entity that has 63,000 healthcare professionals in it, and they were not consulted at all about this Healthcare Professions Act. So then John said, you know what, we have 17,500 signatures that are concerned and want this reviewed. And Adrian Dix has totally declined. So we have 4 times the amount of opposition to what he says is supporting it. And he is refusing to allow a reconsideration on this. The session ended pretty soon after that. There was very little intelligent debate that occurred. They, in fact, when there was specific things that were brought up to the NDP party, they just refused to answer. They refused to provide any kind of concrete information that would actually assist in the governance of what's going on in this province. If you have a chance to watch one of these sessions, you should, because I think it would be quite startling for us to understand the poor quality of leadership that is occurring right now. After that session, we did go outside. John Rustad had organized about 5 healthcare professionals to speak. I am going to put in the comments or put on another post a copy of those speeches that occurred out back. And I think it would be worth it for everyone to understand that when you watch what is going on in this building in terms of the lack of disclosure and the lack of ability to hold this NDP government accountable, while they are in power, we are in trouble. So I'm going to bring that up. I also, just a pitch, I'm not sure how this is going to go, but John Rustad is now going to sort of reignite the Conservative Party. they are looking at creating an umbrella of basically a coalition of independents. And so this is now going to have a little bit more attention, trying to find candidates and people that are willing to create a party that has less party control and more of a control that comes from the MLA actually being able to represent their constituents rather than having to speak and vote according to the party line. So that's just a bit of an update as to what occurred here yesterday. And we are still, as nurses, still trying to fight our BC Nurses Union to represent us. It has been a year and a half that thousands of nurses have not been able to work in this province. And the fact that our government can stop people from working in their location that they live is kind of concerning, and we need to be aware that that kind of control is now starting to seep all through decisions that are going on in this province. So that's your update for now, and we'll be in touch.